once again for joining us. We've been talking to Dr. Yuni Samrakon about breast cancer, which has been really our focus for today, and I'm sure a lot of our viewers can kind of relate to what we're talking about and all these questions that you may have in your mind. So the last question that I had for you was about if you miss kind of early detection phase and then it's a late detection before you go in for surgery or treatment, we're still in between those phases. That's where we left off. So let's get back into that conversation. So what happens at that point?
Yeah, if it is detected later, then we are assuming that it has spread somewhat. We don't know exactly, but we have to do various other tests. We call it staging, where you do now if it is a breast cancer, we check the liver. Then if it is at a different different types of patients, we think okay, maybe it has gone to the bone. There are bone scans that you do and chest X-ray, things like that. Those are staging tests, and then once you do that and you have an idea and also the type of cancer through the pathology, the cells, then we decide. Now this is now at a later stage, so patient may need chemotherapy or radiotherapy prior to the surgery, because that actually helps us to deal with what has spread, as well as making the tumor sometimes smaller. If it is smaller, then maybe again we can go for what we call breast conservation, which means to save the breast, only to remove the tumor and then save the breast. We may or may not be able to do that. The other advantage of treatment prior to surgery is once you do the surgery and you send the tumor for what we call biopsy, then by looking at the tumor, they'll say, okay, the chemotherapy has actually, the tumor has responded to chemotherapy. So this actually helps us decide on what type of chemotherapy we should give post-operatively. So actually that way, giving chemotherapy has multiple benefits, giving treatment prior to surgery at a later stage. Then we go ahead with surgery and then decide on, depending on again various other factors, whether the patient needs radiotherapy or chemotherapy, or in breast cancer there are things called anti-estrogens and things like that, is hormonal therapy. So those are the things that are available for later stages. But again, going back and saying, if we have a screen detected cancer, we can conserve the breast, and that we can do by surgery, and then supplementing it with radiotherapy, and then that actually is a cure.
Now you spoke of chemotherapy, and I know chemotherapy has automatically, at the second you say it, has a very negative connotation. People are very, very afraid of what chemotherapy does. Perhaps it's because maybe we watch too many movies with it, with seeing cancer patients. But really, that fear also sometimes keeps people away from wanting to be diagnosed. So let's talk a little bit about that process and of chemotherapy.
Yeah, now chemotherapy is where you can give chemotherapy in different ways. Now chemotherapy that a lot of patients are aware is where you actually give it IV or intravenous, where you put a needle and give it as a as a drip. So whichever way, now there are chemotherapy regimes where you give it orally, via the mouth. Whatever it is, the chemotherapeutic agent is supposed to kill the cancer cells, and that it does by detecting the rapidly dividing cells, because a cancer divides faster than the regular normal cell. So that is how it detects that and kills it. So there are certain areas of the body which also divides at that high rate, like the intestinal lining or the hair follicles when it grows. So that is why chemotherapy as a side effect has, like, where the hair loss, and then sometimes you get bloody sort of diarrheas, where there is blood, and these are the things people are scared of. But one must understand that this is a very temporary thing. If you lose the hair, you actually get it back once the chemotherapy cycles are finished. So the negative side is, yes, different chemotherapeutic agents have different side effects, which can be hair loss, diarrhea, sometimes loss of appetite, being lethargic, things like that. But that is actually the good news is that it is temporary. Once that is finished, then yes, you go back to the normal process, and then it all comes back again. But chemotherapy is essential if one is to achieve a cure, especially if the cancer is detected at a later stage.
Now, we talked of surgery, and then we briefly talked of, you mentioned, how things like radiology and chemotherapy would help you better if you post-surgery, and how you can identify what would be wrong and what worked for you or what not. But generally, again, that post-surgery phase is also very vital stage in cancer. So how does a post-surgery section work, and what should people focus on?
Once the tumor is taken out and patient is better, clinically better, out of that danger phase, and then the next step is actually to have the biopsy report. Whatever the cancer is, whether it's a breast cancer, colonic cancer, whatever it is, you have to have the biopsy report, because that gives a lot of details, and because it gives the type of cell, whether it has spread, whether we call it tumor invasion into the lymphatics, bloodstream, because that actually gives us an indication of whether this has spread. We call it microscopic spread, which means like it may spread via the bloodstream, but it can't be detected by any type of cancer. As I told earlier, x-rays, scans, they can detect when these are at a certain size. But if it is not of that size, then those staging investigations are baseline ones. So when we have the biopsy report, then we have actually it's like a roadmap. Then we have like a document which tells us, okay, now this is the next step. So following that, we decide with patient now needs, depending on the biopsy report, we need now to go ahead with chemotherapy, which is actually again based on whether the tumor has responded. If we have given chemotherapy before and the tumor has responded, they will now, the pathologists can say that 50% of the tumor cells have died. So they'll say 25, which will give us an indicator whether the pre-surgery chemotherapy, we call it neoadjuvant chemotherapy, has helped. So which will actually tell us next step, post surgery chemotherapy, whether we are going to use the same agent or not. Again, chemotherapy may have the side effects, as we mentioned before. Then following that, whether you are going to give radiotherapy or not.
Okay, Dr. Samarkon, again, these are things that we need to talk about just after this break. We've been talking about the physical aspect of it, but there's also a psychological aspect of it, which we'll touch on very briefly when we come back from this break. Stay with us on Good Morning Sri Lanka.